this pandemic is evolving and evolving very quickly. And one of the features which seems to become increasingly obvious is that, unfortunately for some people, the symptoms of COVID-19 may well persist for many weeks and even potentially months after they've had their initial infection.
No, I was going to ask, is there a typical case? Is there a typical type of patient that is finding the longer-term effects?
Look, at this stage, we don't know. There's been a lot of studies at the moment looking at and characterising the presentation of COVID-19 in the acute phase, so when people first get their infection. And even with that, we're starting to realise that people can often present with quite complex and widespread different symptoms. Now, most people, of course, get the classic symptoms of a mild throat discomfort, some aches and pains. Fever is quite common, though it doesn't persist throughout the entire illness. And around about 1 in 5 people, of course, can get a severe enough infection that can go to their lungs, cause a type of pneumonia, and can put them into hospital. And of course, unfortunately, around about 5% of all people can end up in intensive care with very severe forms of disease. But the numbers of people and the types of symptoms do appear to vary more than what we would normally expect with a standard flu or viral infection. There are a lot of people experiencing symptoms of aches and pains. In older people, more severe symptoms of cough and breathlessness seem to be quite a feature, and even symptoms of abdominal pain, diarrhea, and reduced levels of consciousness. So the spectrum of disease is becoming apparent to be far more widespread than what we would initially have thought with most types of viral infection.
I've just been reading actually an account by the world number 19 tennis player Grigor Dimitrov, who says a month after testing positive, still suffering with exhaustion and also the mental struggles he's having. Are you finding that there has been psychological damage, if you like?
Well, unfortunately, he's not alone. So the one study that has been published was an Italian-based study of about 150 people. Now, only 12% of those people had severe enough disease to put them into hospital. The majority, therefore, had relatively mild disease in terms of COVID-19. But when these people were asked whether they still had symptoms well over a month after their initial infection, well over half of them were still describing symptoms of aches and pains and these feelings of severe fatigue. And the social media is really replete with evidence of people describing the persistence of these symptoms that are present. So both Slack and Facebook have now got pages devoted to people who call themselves long haulers, where they've got symptoms that go on for well over 30 days and unfortunately for some people in excess of 60 days. So of course, if you're an elite tennis player and you have a nasty infection, it will probably impact upon your ability to play elite tennis and that fatigue. I don't know how severely affected Gregor was initially, and so I'd expect his performance would be affected to some extent. But even outside of that concept, people who are not expecting perhaps to do quite so well seem to have persistence of these symptoms for many weeks afterwards.
Very troubling. We know it affects the lungs very badly in some cases. Is there any evidence that it affects other organs in our bodies?
It almost certainly does. Now, most of our evidence in regard to this comes from people with very severe disease, of course. And so that's an important caveat. So people who have very severe COVID-19, who either end up in intensive care, and unfortunately, some of those people will die. There are autopsy studies that show that this disease can cause dramatic damage, inflammation, and horrendous damage, in fact, to the lungs. It does appear to cause some unique changes. It particularly appears to cause damage to the tiny blood vessels in the lung and allow clotting to occur there as well. That can lead to a problem called pulmonary emboli, and that particularly seems to be a unique feature of COVID-19 and one which is not seen with, let's say, pandemic influenza. Again, in those very severely affected people, the virus has been shown to directly damage both the heart and the kidneys. But I would have to hasten to say the majority of people probably don't have disease which is that severe or that widespread. Having said that, larger numbers of people, you can detect the presence of the virus in their bloodstream, at least by very sensitive tests like PCR. And so some systemic spread of the virus is quite possible in a larger number of people, but predominantly it's those who are most severely affected where other organs are most severely damaged.
Are we able to learn anything from the study of other coronaviruses and how they have had a long-term impact on people's bodies?
Well, every virus is a little bit different, but this is a really good point. The previous coronaviruses that we've experienced, SARS and then MERS, have caused or tend to cause very severe, what we call acute disease. So for most people who get infection with those two viruses, they develop very severe infections, very severe forms of pneumonia. A large proportion of people were admitted to intensive care units, and a large proportion of people had a lot of breathing difficulties. Unfortunately, the news is not at all good when you look at those individuals, but I do hasten to say that, of course, the majority of people infected with both SARS and MERS have a more severe form of acute disease. Now, looking at MERS, Canadian researchers have found that well over half of patients complain of chronic symptoms of fatigue and tiredness, aches and pains that can affect them, and unfortunately can actually affect them to such an extent that they can't return to work. And similar findings have been the case with MERS in a Korean study. Well, again, well over half of all people who had a severe MERS infection were still complaining of this terrible disabling fatigue up to 12 months following the acute episode.
Very worrying. Professor Peter Wark, thanks for your expertise this evening.
Pleasure. Take care.
Thank you.